Thank you very much to Andy for talking to us about meanings of home and understanding the concept of home in different care settings. I'm going to take this a bit forward by looking at how these concepts have been reflected in UK policy and guidance. I'm going to take an approach to understanding policy and guidance inspired by Carol Bacchi's work. She calls it "What is the problem represented to be?" approach. Policy analysis often assumes that policy is a response to pre-existing problems and issues.
Oh, sorry, can people hear all of this? I'm not sure. Is it working okay?
Yep. Yes, I can hear it.
Take an approach to understanding policy and guidance inspired by Carol Bacchi's work. She calls it "What is the problem represented to be?" approach. Policy analysis often assumes that policy is a response to pre-existing problems and issues, whereas this approach sees policy and guidance as representing and constituting the issue as a problem that needs particular sorts of solutions, and suggests that we examine the assumptions and ideologies that underlie these representations and think about what effects they produce, what they leave out, what silences we might identify, and how these representations of the problem go on to be disseminated, defended, and resisted. Here are some of the, just to remind you of some of the way that home has been seen as a site of meaning, and Somerville has summarised some of the key features that often come up in the research on home, and I think Andy sort of discussed some of these as well. And Sixsmith suggests that these categories could be understood as kind of along three different dimensions. The personal home, maybe that would emphasise more freedom, independence, self-expression, identity, privacy. The social home, perhaps more around family life, continuity and permanence. And the physical home, so the actual layout and architectural features of home, and how these different dimensions support home as a site of these different meanings. I'm going to explore two main threads or themes in policy discourses around residences and residential support for people with learning disabilities. The first is the ordinary life discourse. I don't know if it was a term that was coined by the King's Fund, probably not, but it's one that they brought to prominence in their documents in the early 80s. So this was a time when people with learning disabilities were moving from hospital to community settings. Policies were informed by human rights discourses and the theory of normalisation, which can be traced to the advances in policy in Scandinavia and also in the US. So normalisation, I guess, as an ideology, assumes that the best way to counter the stigma and exclusion associated with disability and otherness is to ensure that marginalised people have access to normal, everyday, valued roles and activities. So the King's Fund document describes ordinary life as a right and a need, and says what it means is just living like others in the community, not sticking out. Ordinary life, they assert, is what any of us would seek for ourselves, and they say that homes for people with learning disabilities should have the facilities and homeliness that an ordinary working family would ask for itself. I'm picking some of the assumptions here. I think the first one is around the kind of normalisation ideology, that stigma and exclusion are reinforced when people are not seen as ordinary, when disabled people are seen or visible as dependent, infantilised, treated as different or less than. An assumption, and quite a basic assumption, that the ordinary, everyday and remarkable is something that we all aspire to in our work, relationships and leisure. And I think maybe another assumption is that if people are coming from institutional settings with very impoverished opportunities for ordinary activities, that staff will teach them and support them to engage in these sorts of patterns of living that they might not be accustomed to. Of course, the big question is, what is ordinary and what counts as ordinary, and can we all agree on this? So, yeah, I mean, an assumption that, well, we all know what ordinary is, and we all know what living in an ordinary street looks like, but I'm not sure that that's necessarily the case. So, on the one hand, I think this discourse encourages us to use our own experiences as a kind of benchmark, and then take the step of putting ourselves in other people's shoes and comparing our life experiences. There's a focus on outcomes, you know, ordinary life is what ordinary life looks like, and what people are actually doing, and a really kind of big emphasis on inclusion and community level acceptance and belonging. So, you know, you can see how this relates to important aspects of home, particularly feeling part of something, feeling part of a community, living in a place that looks and is laid out similar to other houses around, and the temporal aspect of home as well, the fact that home and our experiences of home change as we grow older, that it isn't a static idea. On the con side, the effects can be overlooking different cultural and religious perspectives on what counts as an ordinary life, and reinforcing perhaps taken for granted views of what is ordinary based on age, gender, or sexuality stereotypes. And I think this is the kind of argument that was really fueled a lot of dissatisfaction with the normalisation ideology in the 1990s and 2000s. Nevertheless, this is this has been a very effective and dominant discourse that is still heard today. It has ongoing echoes in ongoing policy and guidance, for instance in CQC documentation that requires that environments where people with learning disability lives shouldn't feel institutional, so an implicit contrast between institutional and ordinary. And that it should be the site of ordinary kind of interactions with friends and family, or at least it says they should be welcome to visit. It's been taken up by self-advocates with learning disabilities, those who contributed to the REACH standards, which are also meant to inform inspections and benchmarking of quality in residential services. So they state that residences should be a home. So here they contrast the idea of an ordinary home with an office environment. So they assert that there shouldn't be any areas that are out of bounds or locked, or, you know, there wouldn't be if you were in an ordinary home. And I think ordinariness has also been taken up as a rallying call by the Stay Up Late group of self-advocates who have been campaigning for the kind of ordinary pleasures of staying up late, not having a fixed bedtime, and I would very much recommend you have a look at their site and their documentation. But I think some of the resistances are this ongoing tension between the residence as a home and a workplace for staff, and I think that's very difficult to square and resolve. So now I'm going to talk about another discourse which is also continuing to resonate, which is the choice and control discourse. I think valuing people and valuing people now is really kind of prime example of the initial statement of this, a background in human rights and civil rights, and also these documents chart move towards the personalisation and individualisation of social care. So seeing that as the prime goal, that individuals should have be able to make autonomous choices and have control over their lives. So some overlap here with the ideology of neoliberalism and individual responsibility and benefits. So in valuing people, choice is first and foremost seen as a choice among different housing options, some of which don't necessarily seem very ordinary at all. For instance, in intentional communities like the Farm Trust. And there's a requirement that people are given access to accessible information to make judgments and choices between different options. But there's also a kind of recognition that choices should involve more small scale and everyday parts of people's lives, and the policy requires that residents have what they call a real say in not only where they live, but who looks after them, how they live, and who they live with. Again, we can have a think about some of the assumptions and silences in this policy. First off, I think the assumption that it's relatively straightforward to exercise a choice, that choice is a matter for the individual person. I think an assumption that all choices can be accommodated once they've been articulated, and that social care should be developed as or is on its way to being a thriving marketplace where competition for responding to consumer choices will be driving up standards and stimulating new options popping up all the time. The silences, though, are the fact that many people will struggle to communicate their choices. And what does that mean for choice and control? That some options are realistically not going to be available, and I think that's become more and more the case since the austerity period and increasing cutbacks. I think this ignores structural disadvantage, both the group of people with learning disabilities as a whole, whose choices are limited by barriers and discrimination that need to be addressed more collectively, but also the fact that within the group of people with learning disabilities, some people are going to struggle more to make choices, and some people can't wait for their choices to become available if they have higher support needs. A silence about the fact that, particularly living in a group home setting, different people's choices may clash. And going back to Christine's presentation, an under-articulation of the sorts of staff competencies and practices that are needed to find out and support people's choices. Nevertheless, this continues to be a very dominant discourse, which we can find as a key theme in transforming care, in the REACH standards, and the CQC key lines of inquiry make repeated reference to choice and control, and in the promotion of personal budgets and direct payments and individualised care packages. There's certainly also discourses of resistance, particularly from staff. Some you might see as informed by concerns which could be characterised as protective and paternalistic. And I think this quote from Christine's earlier work, that yes, choice and control is all very well for people who are more able, but for our folk, we just have to make decisions for them based on our understanding of what's best for them. And I think another point of resistance is a concern with risk and risk-averse practices, especially where staff don't feel well supported by their own managers or their own organisations, and where choice might involve positive risk-taking. The effects that this policy brings about, well, I think it's amplified service user voice and informed processes like person-centred planning and co-production, and though perhaps with more emphasis on these processes taking place than producing specific outcomes. There's been an increased privatisation in the market for residential services. I think there's been a danger that it's undermined solidarity and collective action between people with learning disabilities, and a bit of a danger that it sets up people competing with each other for scarce resources. It doesn't challenge the reliance on service level solutions, which certainly don't necessarily have to be very ordinary, which might take place in separate or segregated settings. So I think this discourse kind of maybe is one that we can see has more resonance with this idea of home as the personal and the site of independence and control. I'm going to leave you with this quote from the Bubb report by a service user who perhaps sums up some of the differences and achievements of policy over the last 30 years or so. That certainly many places where people with learning disability live look different on the outside, although some of them don't look that different on the outside, but many of them do. So this service user moved from somewhere that looked very different, that stuck out like a sore thumb, to a place that looked great on the outside, like a normal house, but inside continued to perpetuate institutional practices.
Thanks, everyone. That's my presentation. I'd be very happy. I hope there isn't too much clatter from the cat. I'd be very happy if anyone's got any comments or would like to contribute to any of this debate about where policy is going in terms of what it understands to be a kind of homely service for people with learning disabilities. So I'd be very happy to answer any questions or people want to make comments. Sure, Jeremy. Yeah.
I'll just kick it off. Thanks again, really, really great presentation. One of my, I suppose, frustrations is that as you were talking, that sort of national policy context, it seems that when we talk about the home and making it real for people about where that sits, at a policy level, it falls between two stools. One, and you talked about personalisation, and we've got things like the Care Act 2014, and we've got the promise of a adult social care white paper, which will again look at the types of choice and control that's available around housing. But actually, much of our housing supply and growth and funding is also determined by other government departments in housing, and the new DLUC, levelling up. So for me, I think we need to level up housing for people with disability and think not about a health, housing or social care, but a much more integrated approach, which touches on perhaps some of the early stuff that you referred to, the King's Fund. So that's my point I wanted to get across.
Yeah, thanks, Jeremy. I think when I try to have a look at the policy, there's so much kind of different policy departments and kind of policymakers and interest groups that are going to be relevant to this. But I think someone in the chat also kind of has raised this issue that some of the learning and activity and debate around the kind of deinstitutionalization has got quite lost, and some of the principles and important learning from that period we kind of seem to have forgotten it. I remember working in a community learning disability team and saying, yeah, what's happened to ordinary life? And people were like, what's that? Sam, what would you like to say?
Well, I think again, Deborah, I'm going to agree with you. So maybe I haven't been set up to do that today, honestly. But yeah. But what I mean is, I was just going to come in with that thing about. We think that the debate has been lost in lots of places, and the focus on all that. Is it about ordinary life? Is it about reach standards? Choice? What does choice and control mean? And certainly in Learn Disability England, one of the things we're talking about a lot in our work on this is Article 19 of the Convention of the Rights of Persons with Disabilities, and that idea of the same and equal choices as your non-disabled peers. And we don't see much evidence of that. And we also think that language and a lack of rigour around that in lots of places means that people are talking about placements and people are being placed rather than even having that that experience of thinking about what the same and equal choices might make as your non-disabled peers, which we know that finding somewhere to live is a very difficult thing in lots of parts of the country. So, but actually that's not even a process that people are able to engage in or supported to, I think.
I think we might return to that in the panel discussion, you know, the gap between kind of rhetoric, policy and reality, and how we make that a bit more explicit. So I think that's a really good point, Sam.